our mouth, we have bacteria, good and bad, that live there no matter what. The mouth is not sterile. So if you have patients like mine that are immunosuppressed, they can't fight off anything. So even the bacteria that we consider good, if they enter the bloodstream, they're bad. So even that was something that, from the medical side, they were trying all of these rinses to just eradicate all of the bacteria. But I'm like, you can't. You have to have, a balance. It's pretty amazing that everything that we've done is really through education, educating the nurses, educating the healthcare teams, educating the patients and their families. So really all of the impact, and we've published, our data on reduced infection occurrences, and it's impressive that we don't really even, if we could touch the patient, it would be so much more impactful. But everything we've done just really with education.
A tale of two hygienists.
And welcome back, dental people, dental hygienists, dental assistants, dentists, front desk, patients. Welcome back to another episode of A Tale of Two Hygienists podcast. I am your co-host, Dave, and I'm here with my amazing co-star, Jess. And Jess, last week, we're in the curl team. And
We are on
last
the
week,
curl
I was
team.
actually considering, because it's hot, it's July, it is just extremely muggy and humid, and you walk out and my hair is poof. I was thinking about cutting off all my hair. But today, I've been awakened because I know you have amazing curls.
Oh,
And I know that our
thanks.
guest today has amazing curls. And I know you like,
Yes.
I know
Our guest today
you,
got on, and I was like, "You came to the right place. You are
yeah.
among friends, you curly-headed hero." Today we have Jenell Robins, and she is a dental hygienist with more than 20 years of clinical experience and a passion for helping people see the connection between oral and overall health. As an oral health educator at Texas Children's Hospital, she works alongside pediatric oncology and hematology teams to bring preventive oral health into hospital settings and improve outcomes for medically complex patients. Hello. I'm excited to talk about this. Anyway, through her work, Jenell challenges traditional ideas about where dental hygienists belong in healthcare. She focuses on breaking down silos between medicine and dentistry, advancing infection prevention efforts, and demonstrating how oral health can play a meaningful role in whole person care. She is particularly committed to expanding opportunities for dental hygienists to serve as valued members of interdisciplinary healthcare teams. And I am so excited to have fellow curlyhead and fellow advocate and fellow professional with us today, Jenell. Thank you so much for being here.
Thank you guys for inviting me. I'm super, super excited to have this chat today.
I am too, because this year, Utah has just passed legislatively that dental hygienists can now be in hospital settings. So I want to know how you found yourself as a dental hygienist in a hospital, and how can we see more of this? Because we belong.
Yeah. And first of all, kudos to Utah, because this is an extremely hard I guess niche to kind of break into. It kind of sounded, over the years of, I've been doing this for now 4.5 years. And I think I initially went in thinking it was dentistry that was holding us back. And then it's like, no, it's medicine that's holding us back. And it's just kind of a combination of all of the above. And that's really, the longer I'm there, that's what I've kind of seen, is that we just need a pathway in, both ways. We need dental to understand what we're doing, and we need medicine to understand what we're doing. So it is a different role. I don't actually practice as a hygienist as far as any clinical anything. So it's a different mindset for sure. As to how I got the role, that was, man, just right place at the right time. I was just scrolling through, what was it, Indeed, and I saw a job listing for an oral health educator in a pediatric center, but hired through Baylor, but working at Texas Children's. But yeah, I didn't really know what it was all about. The job description was, it was just very this is what a dental hygienist does. I'm going to take x-rays. I'm going to do this. And I thought, how in the world? But curiosity got the best of me, and I just decided, let's just apply and see what happens. and then I found, so I got the call back and I talked to, it was a quality specialist. So they're in charge of like quality and safety in the hospital. And we just started chatting about, my, of course, world peace vision of, medical and dental integration, and it's going to
Mhm.
solve all the problems. And she has a very good friend that's a dental hygienist, and she's a nurse. And so she was pretty passionate about it too, and just was kind of telling me about the role. And I just got more and more excited. And I think that she kind of felt that too. And we didn't really know where the role was going, but she gave me a shot at it. So here I am 4.5 years later.
Oof, fantastic. So, like, typically, medicine and dentistry have operated in separate worlds for like decades.
Mhm.
You literally are in the room trying to like knock walls down. What's the biggest resistance you face, and what has been the most powerful argument for why oral health belongs in the seat of the table?
Well, and you could talk about that forever. Really, Really, it's just providing that education, and again, it's just bringing this different mindset. So specific to my role, I'm in the hospital to help patients that are considered inpatient, so they're inpatient for, 2 weeks, 4 weeks, 6 weeks, 8 weeks, and they're going through some type of cancer therapy. And I'm in pediatrics, so, for all of these kiddos, they're at higher risk for bloodstream infections. A bloodstream infection is a type of hospital-acquired infection. And hospital-acquired infections cost the hospital a lot of money. They, of course, decrease the patient's quality of life, increase their length of stay. So it's in everybody's best interest to try to avoid getting an additional infection when you're in the hospital, getting treated for something else. And so, unfortunately, I mean, it's not unfortunately, it's just kind of the way it is. But, our mouth, we have bacteria, good and bad, that live there no matter what. The mouth is not sterile. So if you have patients like mine that are immunosuppressed, they can't fight off anything. So even the bacteria that we consider good, if they enter the bloodstream, they're bad. So even that was something that, from the medical side, they were trying all of these rinses to just eradicate all of the bacteria. But I'm like, you can't. You have to have, a balance. And then the vision from the, or not the vision, the view from the dental side was like, "Oh, these patients are such at high risk for cavities." But when you have patients that are going through chemotherapy, like our main concern is keeping their mouth healthy so that they don't get a bloodstream infection. So, and then, I mean, of course, we don't want them to get cavities, but that
Yeah.
takes the back burner to them, staying safe and making it through their therapy. So, I'm not sure. I, kinda lost my train of thought there
No, you kept on going.
with
Yeah,
where your question was.
yeah, what I pulled from that is often the barriers are policy, often the barriers are understanding,
Mhm.
often the barriers are application.
Yeah,
I'm hearing that they just try to rinse to kill all the bacteria. There's an understanding piece of that, and then there's also a s an application piece of if you have somebody who is educated in the oral microflora and how, more information is better, but how to use that information in a really proactive way,
right, right.
and then also this hierarchy of needs of where we can be most helpful, and
Yes,
I
absolutely. And it's really, there is an awareness, like, medicine and the hospital, they know that oral care is important, and they know that,
Mhm.
especially, I mean, more and more people are talking about oral systemic links, so they know. But it's who has the time to educate, who has the
Right,
time to make, practice protocols, who has the time to go to individual rooms and
right.
see what's going on, in their mouth during their therapies.
So then we talk about application, like how do we get people in there? And then you bring up, well, then sometimes it's policy or legislation. So, for example, I just before this year, being able to be in a hospital, I would have had to had a dentist on,
Right?
like, depending on your supervision in your state, right? A dental hygienist, heaven forbid a dental hygienist teach how to take care of teeth or do what's in their scope of practice without somebody holding their hand or watching over them. We could talk about that another day. But so
Yeah.
you've got those kind of barriers and then this application barrier, but you found yourself in a hospital. You found yourself in a position to be of help and use your knowledge in a way that is preventing bloodborne bacterial infections. And what does a day look like for you? I know you're not I'm curious, are you doing any oral care? Are you able to do anything like that? Tell us a little bit about what this looks like.
No, and that's I mean, that's it's a double-edged sword, right? I if I could, there's so much more I could do, but then it's also been pretty amazing to see, even though I'm the one to do it, I still think it's pretty amazing that everything that we've done is really through education. Educating the nurses, educating the healthcare teams, educating the patients and their families. So really all of the impact, and we've published, our data on reduced infection occurrences. And it's impressive that we don't really even, if we could touch a patient, it would be so much more impactful. But everything we've done just really with education. So day to day, my job, it's every day is completely different. I have days where I round. So I go with we have a multidisciplinary team, and I have a hematology section, hematology and oncology is one unit, and then I have bone marrow transplant. And so I round with multidisciplinary team members, and we go into high risk patient rooms, and we assess their environment. We look at, their hygiene. We'll see if there's anything going on in their mouth, and sometimes it's just even the basics because you never know, like these are kids, so you don't know what their parents' dental IQ is. So
Mhm.
if the mom and dad have poor dental IQ, then they're not really going to push the child to do too much. And sometimes with these kids, their only point of control is hygiene, because we're telling them what meds to take and when to get up and when to get down. I mean, you have to go do PT, OT, like we're telling them all these things. So then we're like, now you have to brush your teeth, and they'll just smash their mouth closed. Like, nope, not
Mhm.
going to do it. You can't make me do it.
Mhm.
So,
I'm inserting my independence somewhere.
yes, yes, that's what I'm gonna dig my heels in on, because it's the only thing I can control. So yeah, and they'll do that with taking a shower too, so it's kind of all of the above, but so yeah, so sometimes we round, and I do that once a week with the multidisciplinary teams, and we go, throughout all of those units, and then I do my independent rounds where if nurses bring to my attention that there's a kiddo that has mouth pain or they're having trouble getting them to brush their teeth, or maybe there's not a parent there and they just need support, then I go see them. And then I also see patients that are newly admitted to kind of let them know why oral health is so important and to help them get through this journey without a bloodstream infection, let them know what our expectations are, make sure we have products that are good for them, because we have infants to, 20, 22-year olds. So it's going to look a lot different for each age group. And then I also sit on committees for infection prevention, and I sit in a high level disinfection committee. So I help figure out ways to implement high level disinfection in even other areas in the hospital. Because as hygienists, we have that training. And what else do I do? Help create policies and procedures.
Mhm.
So we started a red light therapy to reduce the occurrence and severity of oral mucositis. So I brought that in and helped to implement that. And we trialed it, and now it's standard of care. And
You say that so nonchalantly.
Yeah, I wanna say, and I wanna share with you and our listeners that about 2 years ago, my little cousin, who I consider her my niece because she's basically, my son's age. She's 10 now. She was diagnosed with cancer, right? And it was behind her eye,
Mm,
and she went through chemotherapy. She went through all that stage of getting care and doing treatment. And of course, somebody at that age, they go through a lot in the dental world, right? Like losing teeth, shifting
mhm.
teeth, plaque, all that stuff, learning how to do oral hygiene. And there was a lot of long nights, and there was a lot of nights where sometimes parents wouldn't be there. But being able to kind of go back to basics and educate the nurses,
Good.
educate the doctors, educate the patient, the parents, and it just kind of like opened their eyes that even though there's a lot going on right now, sometimes basics are the foundation of a healthy, less complicated, less complicated procedures in the future, right? Because
Yeah.
at that point, flu, being sick, or having low white blood cells, becomes extremely critical.
Mhm.
And imagine a potential dental infection, imagine gingivitis, imagine all those things that could complex everything on top of that. And so being able to like layer that even further and say basics are not basics. Basics are the fundamentals of overall complex treatment and procedures that the child could be going through, and being able to educate the parents. And I remember my cousin calling me and he was like, um, hey, Camila is bleeding through her gums. What do I do? And this is a problem because she is her white blood, like he didn't call the doctor, he didn't call the nurse, he called me as a dental hygienist. And I was like, bro, at this moment in time, the biggest thing that we have to do is preventive dentistry. We have to do rinses to prevent any potential caries because dry mouth, right? All the whole nine, right? And being able to kind of slow down and reassure the parent that at the end of the day, preventive dentistry is the most important thing for them right now to avoid any further complications in a very like unsettling environment, right? Oncology is very important, right? And so I love that you're saying this. I love that you're providing so much information out there because it happened to me, right? And I'm just like she's just my cousin, right? But things like that we go through on the day to days is very impactful in dentistry as well because for somebody who's 6'7", like they start 6'7", as the kids are saying nowadays, they go through that stage of like shifting teeth, and it could become a complicated procedure, right? I mean, imagine the core memory of losing your first tooth. Now
Yeah.
imagine that core memory of losing your first tooth with low blood, white blood count cells, and being in the hospital and your parents not being there. It becomes daunting, right? And so being able to kind of reassure the parents, the medical providers, and the patient that it's okay. And here's how we're going to navigate that through prevention is it's extremely impactful and ideal. So thank you so much for doing those things.
Yeah, yeah. No, I love hearing those stories, and thank you for sharing your story because yeah, I mean that's what we see every day is it is a world where it's constant unknowns and what's going to be thrown at, not just the I mean, the family of course, but the patient like they're here, it's scary for them. A lot of times they're left out of sometimes good, sometimes bad,
Mhm.
conversations. So it's a tough environment sometimes, but yeah, sometimes just the basics and trying to help them that way. And then also, you know, I think when you're in the situation, like what I've seen is, I mean, you can do everything right. And then our patient population, being that they're kids, they lose a tooth and now they have a direct pathway into their bloodstream. So
Mhm.
what do you do? So we can't prevent 100% of the infections. We try, all you can do is, I mean, it's like you can't prevent every car accident, but you wear your seatbelt and, and
Mhm.
you stop and stuff. So it's the same with what we're doing. We just try to put them in the best situation that we can. So, as far as cancer therapies, I mean, oral mucositis is one of the most devastating, and with kids, they're 3 times more likely than adults to get it. A lot of times they just have very, very harsh treatments that just really just tear up their whole system, and so they can have perfect hygiene, and that's setting up the best possible situation. But yeah, if
Mhm.
they start getting sores all over their mouth and down their throat, it gets really tricky to keep the bacteria that normally live in the mouth out of the blood. So, yeah.
So you just nonchalantly started a revolution in the hospital and you started using red light therapy. Tell us about that.
Yeah, well, and this is where I think, and when I speak about this, because I try to speak as much as I can to get kind of what I'm doing. And there is actually another oral health educator that does, well, pretty much exactly what I do. She has a couple more units in the hospital that she takes care of, but she's Catherine Martinez out of Phoenix Children's. But we talk a lot because we're the only two in our exact situation that we know of. If there's somebody else out there, please contact.
We'll make a
um,
group. Hopefully you also have curly hair.
Yeah, she doesn't have curly hair
Oh,
though.
okay. 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 All are
Um,
welcome. All are welcome.
yeah, so red light therapy, really the benefit to having a preventive oral health specialist in the hospital in this part of the multidisciplinary team is that we are so prevention focused. And when I started at Texas Children's, one of the first rooms that I went into, one of the clinical specialists, which is a nurse, she's like the special, or she or he, whoever it is, this one was a she asked me to come see this patient with, grade 4, which is the worst grading of mucositis. And I went in, and this poor kiddo was, just lips were swollen. I mean, everything in his mouth was just open and bleeding. There was no, I mean, it was it was devastating to see, and still the worst case of mucositis I've ever seen. But the clinical specialist said, "Okay, so, this is where we're at in treatment, and this is what's going on. How can we prevent infection in his mouth?" And one, of course, I had no idea because I'd never seen anything that terrible before. And just from a human perspective, like, or human emotion, whatever, this is another human that is, I mean,
Suffering.
suffering like you could just feel it and then some,
Mm.
and I was just trying to hold it together, and I'm like, "I don't know how to prevent infection. I'm gonna step out," And that kind of motivated me to figure out, like, okay, once they're this far along with mucositis, it's almost too late. I mean, we can do things to try, but he's so uncomfortable. I mean, what are you gonna put in his mouth? He doesn't even wanna swallow his own saliva,
Mm.
It's
everything
so
hurts.
painful.
So, is there something we can do to prevent this? So I had just taken my laser safety class in Texas, and I was like, "Woo, I'm laser safety, whatever, yeah, or laser certified." But I knew there was no way we can't use lasers, right?
Mhm.
Especially, I mean, if I can't touch a patient, there's no way they're letting me like run around the hospital with a laser. Um,
Right.
but I
But she'd be
started,
good at it. Who if anyone who is in a hospital is listening to this, and if a laser is gonna be helpful, put it in the hands of a dental hygienist, she'll be good
yes.
at it.
Yes, there's so many things that we could, yeah, if you would just let me touch a patient. But yeah, so I found out that St. Jude was actually doing red light therapy with LED lights, to prevent and minimize the severity of oral mucositis. So I reached out to them, and then they told me the company they use, and then I reached out to the company, and my contact there was a dental hygienist, and she was really passionate about how impactful red light therapy was, for this patient population. And it's something that outside of the United States, a lot of countries have been using it and publishing, but just it hadn't quite caught on here yet. So we agreed to, let's do a trial, and we brought it in, and I had to train nurses how to do it since I couldn't do it. So I would go in with them and tell them like where to hold it. And then I would teach them how to do oral assessments. So what we're looking at, what the surfaces are called, because we needed to capture all of this
Man,
data.
man,
And
Janelle, when you talk about who has time, who has the ability, come on, policymakers, Janelle can do this. Until then, she's gonna do a really good job telling the nurses how to do it. So you're telling them where to put the light, so keep going, Janelle.
yeah, yeah, and just like, what are you looking at? What are you seeing?
Mhm.
This is normal, this is abnormal, just because 'cause they're not taught that. I mean, my daughter's in nursing school, and I mean, she can attest for they're not focusing on, they're kind of like, "It looks pink in there, it looks wet in there, we're good." Are there any giant holes anywhere? Is there a gaping gash anywhere? That's kind of the gist of it. So yeah, just educating them on even positioning, like how are you going to look in a 4-year-old's mouth, in 15 seconds. So we did that. We collected data, and the results were, I mean, amazing. I hadn't been there long enough to see many, many, many kids that had that severity of mucositis, but some of the nurses that had been there for, 10, 20 years were just saying that it was a totally different feel on the floor because, I mean, if you can imagine kids that are suffering that bad, or I mean, adults too, I'm sure, but my experience was with kids, but they just shut down and they don't want to eat anything. And then as a parent, you see your kids stop eating, and that's really stressful. And you're like,
Scary. Mhm.
what can I
Mhm.
do? How can I help them? So just to be able to get the kids back eating and not having to be, knocked out on pain meds all the time. And, I mean, all of that just increases their quality of life, it lowers their infection risk, it just brings hope to the table. You don't see, this that decline in just the whole. I mean, sometimes it would be like they would turn the lights off, close the blinds, and, just while they were suffering, and then once everything, maybe 2, 3 weeks later started healing, then everything kinda comes back to life, and it's not like that anymore. It's, much, much improved. So through that, we published, and now there are other children's hospitals that I talk with. They talk with St. Jude, and now we have, it's super super cool to see, like, that there is a desire to do better. It's just people don't know where to start or have the time for it or the expertise, embedded in their team.
So you're quite literally changing what it means to be a dental hygienist in America. One hospital like hallway at a time. So I have to ask you, what do you want the profession to look like in 20 years? Because I know you've been doing this for 2 decades, but because of the work that people like you are doing right now, and what do you hope every hygienist listening to this episode takes away from this conversation, or advice that you can give them if they want to do something like this one day?
Yeah. I think, just think outside the box, when if you even in clinical practice, if you hear patients that are saying the same thing, over and over, or just one patient that really gets you, like there's an issue that, maybe it's a burning mouth, or maybe it's, whatever it is, and you feel something about that, like, start looking into it, see if there's something, and if there's not, keep looking. I mean, I went down so many rabbit holes with this red light therapy. I rabbit holes are kind of where I live, so it was, but you have to, and not every hygienist is going to want to do this, right? Um okay, I'm gonna come back to that in just a second because that's a whole nother where I see the profession going. But for hygienists that want to do something different, don't say, "Oh, I'm not allowed to do this," or, "Oh, I can't," just have to, like, network and keep telling people and keep looking and, get comfortable being uncomfortable so that you can try to infiltrate some type of a spot, and, like, when I answered that ad, I had no idea, but I was like, "You know what? It'll at least be maybe practice interviewing."
Yeah, well, and you
Um,
could have been, like, little spicy with a chip on your shoulder, and you're like, "Well, if I can't do it, I'm not gonna do it." But
100.
instead, you're the eyes, and you're the ears, and you're the voice to the nurse that's doing the therapy, and that's a better step than nothing at all.
Yeah.
Mhm.
Yeah, and it's, just a side note, when I've done some surveys with the nurses that, because I also teach classes to new nurses that are coming into cancer center about oral health, and, so I've done, some surveys with them, and they'll say that they appreciate, being given some verbiage and some, additional training so that they feel more confident taking care of, patients that are more medically complex too. And then being there, they know that, just like if you needed a gastroenterologist, or if you needed, OT or something, occupational therapy, if you need that additional support, there's somebody there. If we're not there, there's nobody for them to pull that support from. And so they just kind of like, I don't know. We just have to kind of get through this, do the best you can. I mean, every other part of the body has a specialist, I guess, at the table, when it comes to holistic care, and except for dentistry, we don't, the mouth and,
Yet.
um, but then I was gonna come back to something. Oh, yeah, the profession itself. I think being in a hospital, I've seen how nurses have just so many pathways that they can go, and I think part of that is because they're self-regulated, and so if you want to work bedside, just like if you wanna be in hygiene and work clinically, that's amazing. People have to do that, and some are so passionate about it. I did that for 20 years, and then finally I was like, "Oh my gosh, my back is about to break over." We did not have great ergonomic classes back in the Stone Ages, so, so I wanna do something else, and the more I was doing it, the more I was like, the oral systemic relationship is so obvious. I want to
Mhm.
teach more people about that. But in nursing, you wanna work clinically, that's fine. You want to teach other nurses, that's fine. You can be an educator. If you want to be in charge of the policies, you can do that. If there's just so many different avenues that you can you can take as a nurse. And if you're a nurse and you like to do all these graphic things, you can do informatics, and you can be like the data statistic person for trials and such. So I think if dentistry, if we could have, or dental hygiene, we could have something like that where hygienists, if you want to do this, then like to work in a hospital, we have to have a bachelor's degree. If you want to be in a leadership position in the hospital, if you're a nurse, you have to have a master's. So, and I know that sometimes hygienists get kind of salty about, oh, I know the same thing everybody else knows, but clinically, we all are taught the same thing. But where I see the difference is, because I'll tell you real quick, when I started there, I had my bachelor's degree, but as I kept getting involved with the leadership and having leadership ask questions, and then, had to put projects together, I realized like there were things I just didn't know how to do. And I actually went back to school to get my master's, and my master's in health education and behavior. And I just graduated in May. But
Congratulations.
thank you. But that program specifically taught me like how to do a needs assessment, how to plan an intervention, how to assess it, how to speak the language that the hospital higher ups and administrators need to hear to make, to buy in. So then you're more credible if you can speak their language.
And there might be some hygienists that are listening to you right now and go, oh, that was part of my bachelor's program. I know that it's part of our bachelor's program, how to do a needs assessment, how to create policies, and how to get into the community. So if you're a dental hygienist that goes, oh, I already do know that language,
Hmm.
this could be an opportunity for you.
Right.
And Janelle, we just want to thank you so much for taking those opportunities and for seeing the potential in an Indeed job description and going, "Hey, I can do that." And not only can you do that, but then you can make an impact. And not only can you make an impact, then you can make a standard of care. And not only can you make a standard of care, then you can do research. And then you can influence other bodies that are doing this work. And Janelle, just a huge thank you for showing us what hygienists can do.
Yeah, you're welcome. And thank you for letting me talk about it, because I want to give hygienists that confidence that, you do know what you know, but you also don't know what you don't know. So,
Right. So be open.
but you can know it. So yeah, if you have the passion for it, just don't stop, just and network and learn what you need to learn, and just keep talking to people. I am such an introvert, but I am now an uncomfortable baby extrovert. But I mean, it just depends what you want your goals, and, what's going to make your heart happy at the end of the day. What will be your passion? What will make, you feel good about what
And
you've done.
there's room for your passion.
Thanks. You
Absolutely.
too
I
can
mean,
do it.
You too.
yeah, it always brings me back to that quote, that I heard back. It was like work harder on yourself than you do on your job. And I feel like as hygienists, we can resonate with that. I mean, I can tell you that my sister is in nursing school, and I told her one of the reasons why I think it's a great career is because there's so many outlets, right?
Mhm.
But that's because I was so close-minded to hygiene only being clinical. But you're a testament of literally that quote, which is work harder on yourself than your job, right? Be who you want to be, and be able to kind of like push those boundaries, and ask yourself the question, what else can I do, right? And so thank you so much for coming over. Thank you so much for giving us a little bit of like who you are and what you do each and every single day, and the difference and impact that you're making each and every single time you speak to a patient or a provider. And it's just been so amazing to talk to you. And I really just want to say that at the end of the day, if this conversation empowered you and motivated you, is because we just ask more questions. And I hope that being able to kind of listen to this episode motivates you a little bit further, because imagine what a person out there listening to this could do and how that can change their career. So I'm really excited for that. We're making an impact, you guys.
Yeah.
One conversation at a time.
Yes. That it has to start like that. So, and thank y'all so much for having me.
It's our pleasure.
Of course.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, Share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends. Share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David.
And Jessica,
And until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.